So we continue with our talk about CBT for depression. As I mentioned last time, we talk a little bit about what is depression and what is the treatment. So the part that we're going to cover today about depression is just some information about the treatment and the risk factor or the causes of depression. So the most accepted theory for depression is a genetic. Like if there is a family history, this mean with depression, this mean there is higher chances that you're gonna have depression. It doesn't have to be depression, like any neurotic problems, like if there is a family history of addiction and anxiety, depression, this increase the risk of having mental health problems and depression. Another accepted theory for depression is a neurotransmitter dysfunction. Like you have neurotransmitters, like serotonin, dopamine, norepinephrine, these neurotransmitters. We know that people who have depression, they have certain area in the brain that they have less serotonin. However, some people, they still have normal serotonin levels, but struggle with depression. So it is more complex about they're still looking at serotonin is low or high. It depends on the circuitry in the brain and the different area and how it works. But the serotonin is involved. The only evidence for this chemical theory is when we give something that increase serotonin, 50% of patients get better. So antidepressant doesn't always work. Lots of people, I would say 50% of them, antidepressant doesn't work, and you have to look for other treatment plans. Another risk factor or cause for depression is the low self-esteem, negative environmental factor like unemployment, lack of social activities, history of any kind of abuse. These all are common factors that cause depression. Also, a different psychiatric problem. We know, for example, anxiety for years will end up with depression. Also, alcohol abuse or substance abuse, you go high, but then there is low after any high. So this is how it works. Also, depression is associated with dementia and eating problems. So all these are different causes and explanation why depression happen. As I mentioned last time, female are more vulnerable and have higher prevalence for depression than male, and there is multiple reasons for that. We covered it last time. Again, the family history and genetic component, loss of parent at early age. This is a huge risk factor. Lots of study about this one. The negative home environment, as I mentioned, neglect or abuse. Also, certain personality are struggle more with depression or depressive symptoms, like being insecure, dependent on others, being self-critical, pessimistic, obsessional, obsessional personality, not OCD. Also stressors, also postpartum. That's why any doctor who meet with patient after delivery, they ask how's your mood, because it's common to see depressive symptoms after pregnancy. Lack of intimate relationship and the lack of or social isolation. Another way to look at depression is a cognitive. So psychodynamics mean certain things happen in childhood cause certain defense mechanisms that cause depression. I'm not gonna go into details into this, but maybe later next session. But today we want to cover the cognitive theory of depression, which is CBT is built on this one, that sometimes you think in a certain ways that can cause depression. If you have negative thinking, it can cause negative feeling, which is most common one is depression. And the example for the negative thinking that can cause depression are these ones. We discussed them before in the, by the way, I uploaded on YouTube all the sessions that we did in the past. So if you want to look at CBT basics and CBT for phobia and CBT for addiction, we covered all these topics. If you want to look into them or listen to them, I added them with the PowerPoint. So, and I covered this part in details in the CBT basics, which is that we call this cognitive distortion. This is an irrational way of thinking that can cause depression and anxiety as well. One of them is black and white thinking, catastrophizing, which you expect the worst. Labeling is to give yourself a label, like I'm a failure, I'm a loser, I'm unlovable, I'm unlikable. If you have these core beliefs, gonna cause depressive symptoms. Self-blaming, and sometimes we call it personalizing. So any negative event that happen, you blame yourself for it. If you have kids who fail at math, it's because I'm not a good parent. If your husband had an accident, because of me, he was distracted because of me. So you personalize every negative event in your life. Filtering, which is another name for discounting the positive. You filter everything, you see only the negative, and you discount the positive. So these are all negative thinking pattern that can cause depression. And this is a cognitive theory. So we can look depression, we can look at it as a chemical disturbance. We can look at it as a cause of genetic problem. We can look at it as caused by psychosocial problem, like unemployment or abuse or childhood neglect or something. And we can look at it, it is caused by irrational thinking, like this stuff. So make sure before you start any on antidepressant that your doctor do some blood work, because sometimes the depression is caused by physical problem. Okay, I have seen it a lot. Hypothyroidism, low thyroid hormone cause depression. I have seen it a lot. HIV, I have seen it also. People have HIV, and the first symptom is depression. MS, multiple sclerosis, cancer, alcohol, beta blocker. This is common. I've seen it all the time. Like someone get heart attack, they see a cardiologist. The cardiologist starts them in a medication to slow down the heart rate. We call it beta blocker. One of the common side effects of beta blocker is depression. So anyway, we need to rule out the physical causes of depression, and we do this by physical exam and some blood work. This is a questionnaire we do it at family practice for patient to assess for depression. It is basically, it's gonna ask you about all the depressive symptoms. So if you have just a depressed mood, this is not depression. As I mentioned in session number 1 about depression, depression have 9 symptoms. Okay, if you have 5 out of 9 symptoms, yeah, this is clinical depression that need treatment. Okay, so for the treatment, one of the main treatment is what we're doing today is the CBT. We talk about cognitive behavioral therapy, and the CBT, you can do it in individual setting with a therapist, or you can do it in a group therapy setting. This is one of the most effective therapy. Another treatment is a biological treatment like antidepressant. And we will talk about different types of antidepressant next session. Another therapy is light therapy. It's like a light machine. It is on Amazon for $50, and it work only for people who have seasonal depression. So if you have seasonal depression, order light therapy from Amazon. It's $50. It works great. You're gonna expose yourself to this light half an hour every day. That's it. Easy fix. But it works only for people who have seasonal depression, especially in winter. Like now, if you get depressed every year at the same time around winter, you need to buy this from Amazon. Anyway, these are treatment. There is we have also something electroconvulsive therapy, which is treatment with electric shock. We use it only in severe depression or depression with other symptom like psychosis and catatonia and severe forms of depression. Magnetic stimulation is another form of therapy, and you can qualify for this one if you fail two antidepressants. So your family doctor can refer you to electromagnetic stimulation, which is not electrical stimulation, it is a magnetic stimulation. This one you need to be under anesthesia to be done, but this one is 1 hour session. You don't need anesthesia for it. It doesn't have very minimal side effect, maybe headache a little bit, that's it. Comparing this one to antidepressant is way better. But to qualify for this treatment, you need to try 2 antidepressants first. If it doesn't work, ask your family doctor to refer you. It was private for a while, but now you can access it through Alberta Health. Anyway, we don't use this very common, like this is for research mainly. But anyway, antidepressant is effective therapy, light therapy is effective. This is for hospital setting. This is for outpatient setting if you fail some of these. The most effective therapy outpatient is to combine this with this, to combine antidepressant with a CBT. Anyway, we'll go back to CBT. We'll learn some exercises for CBT. As we mentioned, the main foundation for CBT is thoughts cause feeling, feeling cause behavior, and so on. Depressive thoughts cause depressive feeling, cause depressive negative behavior cause more negative thoughts, more negative feeling, and the cycle continues. So we need to break the cycle somewhere. And the first session, we learned how to break it here. You remember with behavioral activation. Like I told you, do some things that induce pleasure, do some things that give meaning in life, and do some things that give you sense of achievement, right? These, like here, forget about the thoughts and feeling, like just do something that cover here. And this is first session. Second session, we learned how to handle the feelings, the negative feeling. When you have negative feeling, you need to write them down. You need to see if you are coping with them in a negative way or a positive way, and try to find alternative positive skills, positive coping technique to cope with the negative feeling. Today, we're going to work on this one, the thoughts, which should try to replace the negative irrational thoughts with more positive. Okay. So again, if you have depression, you need to be working in all of these. Do something, you have to be doing something. Okay. Don't stay in bed the whole day. You need to go for a walks at least, or call a friend, or do something without even having the motivation or the mood to do it. Okay, how it changes the thoughts. So there is one exercise. I have multiple exercises today. I want to choose 2 to work on them. So one of the exercises is just to identify the distorted thoughts and replace it with rational thoughts. For example, you remember this example from last session, someone with depression, he's saying there is nothing left to live for. Okay. And then he tried to replace it. This is very negative. And there is a like black and white thing. Everything is black. There is nothing I can live for. But then he can replace it with more gray thinking. No, I can live for my mom. I have faith in God. I have a dog that I care about. So there is some stuff I can live for. You see, another guy, we had this example last time. He's trying to get into medical school, but he is hopeless and helpless. So this is common with depression too. I can never get into medical school. Even he have a good, resume and he meet all the requirement and good GPA and everything is good. It's perfect for medical school, but he still believe I can't get in. And if you believe you can't get in, you will not get in. Okay, so this guy, he need to have more confidence. Also, he need to be accept if he couldn't get into medical school, he need to have plan B or plan C, what he gonna do. So I want you, for on your side, I want you to see or to look into some of the distorted thought or negative irrational thoughts and try to replace it with more rational response. And as I mentioned, you know, catastrophizing, black and white thinking, labeling yourself with a negative label, like discounting the positive. These all different ways of distortion in thinking. This is one exercise, so easy. Give me situational, a thought related to a situation, the thought related to situation. Another one is identify a healthy belief and the unhealthy belief. There is something else in CBT called the core beliefs. It's like have one core belief that you live with. It's like a label. I am worthless. I am dependent. I'm a failure. I'm unlovable. I'm unlikable. I'm hopeless. You know, and then these, if you have one of these beliefs, one belief will bring thousands of automatic thoughts all the time. So if you believe I'm a failure, everywhere you're gonna go, you're gonna bring different ideas that just to confirm the main belief. Anyway, I want you to tell me what unhealthy belief you struggle with and how you're gonna replace it. So, for example, you can say, I'm a failure. How we're gonna replace it? No, I can replace it with I can succeed. I am unlovable. I can replace it with I can be loved and love others, for example. I'm worthless. You can replace it with I have value. But this is easy. You tell me, oh yeah, I struggle with failure. I am a failure. Then you replace it. I can succeed. That's it. Okay, but what I want you to tell me is not just the belief, tell me the evidence for it. So if you tell me I'm a failure, tell me what is the evidence. And then if you replace it, no, by the way, I can succeed. Okay, if you say I can succeed, give me evidence. Okay, so find an unhealthy belief and then try to replace it with a healthy belief. And give me evidence for unhealthy and give me evidence for healthy. I'm not, you know, in CBT, we are not denying that there is negative things that happen in life and there is failures that happen at certain point, but also we try to find silver lining and try to put hope and replace something from black and white thinking to more like gray and see both negative and positive side. And here is an example, but again, you're gonna do your own. But this is this guy who was cut off from basketball. He was ridiculed by his high school teacher. He was yelled at by his dad all the time. He was unfriended by high school friends. He had a car accident while he is texting a friend. These are all evidence that this guy is a failure. Then, okay, in CBT, we try to replace this idea with I can succeed. So we tell him, okay, if we replace this with a positive one, it will be I can succeed. Give me evidence that you can succeed. And then if he with the help with his family or with the help with journaling or with the help with a therapist, he can identify certain areas. Maybe he passed or he got his high school diploma. Maybe he's doing well at his current job and he have maintained a job for 9 months now. He started seeing a girl and she seems to be interested in him. So you see, he can succeed at a job with a relationship. He got a certificate, high school diploma. So his mind with depression focus only on the failure, but we can replace it with this one. So anyway, you tell me something you struggle with, replace it, give me evidence for the negative side, give me also evidence for the positive side, and I want you to see both. Okay. This is another example. We don't have to do it. It is the same. Okay. The last exercise is acknowledging your pain and counting the blessing. You know, the same idea. You acknowledge negative situation, but also you acknowledge positive things you have in life. Lots of our patients, they seek validation for the pain, but they don't want anyone to challenge their thoughts. They just need validation. But if you are seeking only validation for the pain, you're gonna suffer from victim mentality. We wanna, as I mentioned, we all are victims to some degree, okay? Because we're all gonna die, so we all are victims. Done. But we also have positive life experiences we can reflect on. However, the end is the end. But if you live just with focusing on the negative, it's gonna be cause more problem and more suffering. So you need to see the silver lining all the time, even a little bit of good in a bad situation. So anyway, this exercise, easy exercise. This is a way to acknowledge the negative and also see the positive. So for this lady, she created an acknowledgement log for her painful situation. She said, put me 3 negative situations. Say, okay, my sister said mean words to me. My supervisor criticized me all the time. My husband left me. So 3 negative situation. Okay, we acknowledge the painful situation. Then we ask her, there is anyone you can talk to? Yeah, I can talk in my group, like this group. I can talk to my priest. I can talk to my co-worker. These are people I can talk to. Why you talk to them? Because they validate me, and this is positive, but also they challenge my thoughts and they help me to see also the positive side. So when you ask here, tell me some blessings in your life, tell me, oh, you know what, my supporter group is a blessing. I have a gym membership. This is a blessing. I have a list of songs that I listen to when I'm depressed. This is a blessing. It is a nice day today, so it is a blessing, and it is actually a nice day today. My sister, my nieces, my dog, my aunt, watching movie. These are all blessing in my life. So this is the exercise. You're gonna tell me painful situations that you have in life. And if there is any losses, tell me about them. And tell me about some people you can talk to about these painful situations. And tell me about some blessings in your life. So again, the exercise today, you tell me about painful situations that you struggle with currently, or some of the losses you're currently dealing with. People you can talk to. It could be me, your doctor. It could be group. It could be your mom. It could be a friend on social media, someone you can talk to. And then tell me some blessings, like some positive things you have in life. I'm sure just living in Canada, this is a blessing. Okay, comparing it to other countries. So don't tell me I don't have any blessings. So this is one exercise to acknowledge the pain and tell me, try to find the silver lining. Another exercise is to unhealthy belief. What is the evidence for it? Then replace it with more a healthy belief and try to put an evidence. And as I mentioned, you know, I am a failure. This is the most common one I see in my practice. I am unlovable, very common too. There is no hope, hopelessness. This is very common. Mistrust. There's no one I can trust. This is a common core belief. about others. You're like, I'm a failure, I'm unlikable, unlovable, hopeless. This is about me. But also there is core beliefs about other, like mistrust. I can't trust anyone. How are we gonna replace this? No, there is people I can trust, and there is people I cannot trust. But still, there is people I can trust. And then you give me evidence. Who are these people? So you see, you identify the negative beliefs and negative and the positive or rational belief. The last one is a distorted thought. What's the difference? Okay, it seems that this exercise is similar to this exercise. This is part of CBT, and you need to be, know the difference. So a belief is one belief that you live. It is like a prescription glasses or eyeglasses. Like if you have it blue, you're gonna see everything blue, right? This is a belief. But the distorted thought, this is a way of thinking. It is, and we have classification for them as black and white thinking, catastrophizing, personalizing, discounting the positive. These all are a way of thinking. So try to identify certain ways of thinking. You can put it as a situational, like these guys. Like there is nothing left to live for. This is black and white thinking. I will never get into medical school. This is hopelessness. I can't live without hair in my life. This is catastrophizing as well. So anyway, you try to find a situation that you think irrationally about it and try to replace it with more rational. This one is a belief that you want to change to a healthy belief. And the last exercise is acknowledge a painful situation or losses, and who are the people you can talk to, and what are blessings. So you acknowledge the negative. Also tell me about some of the positive that you have in your life. I'll give you a few minutes to think about it, then Brooklyn will run the discussion. Thank you.